Geraldine Lanzaderas, your student nurse for today. And I will be going to show you the physical examination about the comprehensive geriatric assessment. So here with me is my geriatric patient, Mr. John Galiemet. So assuming that I already closed all the windows and curtains to secure his privacy, and assuming also that I already washed my hands. So first, I will going to assess his skin color, the uniformity, and if there is a visible lesions. So as I inspect, there is no visible lesions. His skin color is even and the uniformity of his skin is normal. And now I'm going to palpate his skin for its moisture and check his skin turgor. So as I inspect, his skin moisture is smooth and soft while its skin turgor springs back to its original position. Now let's proceed to the assessing of the nails. So first is I'm going to inspect his nail texture, plate shape, and his nail bed color. So his nail texture is smooth and plate shape is curvature in shape, and his nail bed color is pink, and which is good. So the next procedure is assessing the head. So first I will inspect his hair. So his hair is evenly distributed, and the texture and oiliness of his hair is silky, and the thickness of his hair is very good, and there is no sign of infection or there is no lice visible. So next is assessing the skull and the face. First, I will inspect and palpate his skull for shape, size, and symmetry. Then, if there is visible lesions, depressions, or masses. Then the last one is assessing the facial symmetry. So his head is normocephalic, which is normal, and there is no visible lesions, nodules, and depressions. So please, can you smile, sir? So his facial movement is symmetrical, which is good. So next is assessing the eye, the structure, and the visual acuity. First, I will inspect the eyebrows for hair distribution. Second is the eyelids for its ability of blinking, the conjunction, and the cornea for its clarity and texture. So his hair eyebrows is evenly distributed. His eyelids is no sign of discoloration. Please blink, sir. His lids close symmetrically. And now for its conjunction. His conjunctiva is smooth and pink in color, which is good. And now for its cornea. So the details of his iris are visible. So next is the inspection of the pupil for its color, size of symmetry, the reaction to light, and reaction to accommodation. So his pupil is 3 to 7 millimeters in size, in diameter, and the color is brown. Next is the reaction to light. So pen light. So his pupil constricted when it's hit by the light. Next is the accommodation. Please follow this pen, sir. So his pupil constricted when the pen is near, and it's dilated when the pen is far, and converged when it is by his nose. So the next procedure is assessing the ears. First, I will inspect and palpate the auricles for its color symmetry, elasticity, and its tenderness, then the hearing acuity. Ear color is the same as the facial color. Its elasticity is the pinna recoils when it's being folded. So now for its hearing acuity, please repeat after me, sir. 1, 5, 2, 3. So the patient is able to repeat the non-consecutive numbers. So next is assessing the nose. First is I will inspect and palpate his external nose for any deviation in shape, size, or in color, and flaring of any discharge from the nares. Then, to determine any area of tenderness, masses, and displacement of bones and cartilage. And lastly, the patency of both nasal cavities. So, for the nose, I'm using the gloves to avoid any discharge. Please tell me, sir, if there is pain upon palpation. So there is no tenderness and no lesion. Then I will inspect its color. So your nose is symmetric in shape and no discharge or no clearing. Then, so to test the patency of both nasal cavities, please close your mouth, sir, and breathe only with your nose. Please cover your left nose and your right. So as I observe, air is restricted in both nares. So the next procedure is assessing the mouth and the oropharynx. First, I will inspect the lips and the buccal mucosa, followed by the teeth and gums, the tongue or the floor of the mouth, the tongue movement, and the tongue movement. So for the inspection of your buccal mucosa, please open your mouth, sir. So the color is pink, which is normal, and your lips also even with your facial color, and your teeth and gums. So it is pinkish in color. And so for the tongue movement, please move your tongue left and right. So your tongue moves freely and no tenderness upon moving. So the next procedure is assessing the neck. First, I will inspect the neck muscles, observe the head movement, and palpate the thyroid glands. Now I will inspect the neck muscles. So your head is centered, and the muscles is equal in size. And next, for the head movement, please turn your head left, right, down, and up. So the range of motion of your head is good and without no discomfort. So for the thyroid gland, I will palpate it for its smoothness. So as far as I palpate, its thyroid gland is okay and normal. So for the next procedure, it is all about assessing the thorax and the lungs. First, I will inspect the shape symmetry of the thorax from posterior and lateral views. Next, I will palpate the posterior thorax and then the posterior chest for respiratory incursion. So for the inspection of the shape of the posterior and lateral thorax, assuming that my patient has no clothes on. So the shape of the chest is symmetrical. So now I will palpate the posterior thorax. So skin is intact and the temperature is uniform. Now I will palpate the posterior chest. Please breathe, sir. Again. So for the respiratory excursion, as I palpate my patient, his chest is full and symmetric, and when my client breathes, my tongue moves apart as an unequal distance. So first, I will inspect the anterior thorax for its breathing pattern and auscultate for the breath sounds. So your breathing pattern is normal, which is under 20 to 26 beats per minute. And now I will auscultate. So the anterior thorax is normal. No abnormalities in his breathing pattern. So the 9th procedure is about assessing the abdomen. And first, I will inspect his abdomen for skin integrity and for contour and symmetry. Now I will check for its symmetry and contour. So his abdomen is flat and rounded, which is normal. So now I will auscultate his abdomen for any vowel sounds. So, as I auscultate, there is no visible vowel sounds or audible vowel sounds. So, the last step of the assessing the abdomen is palpation of the liver. Please tell me if there is pain upon palpation. So, the liver is in normal condition. So the last procedure of assessing the geriatric patient is assessing the musculoskeletal system. First, I will inspect its muscle for its size and then inspect for if there is any swelling. Now inspect his muscle for So his muscle is equal in both sides. So next is to palpate each joint for any tenderness, smoothness of the movement, swelling or crepitation, and presence of nodules. And then I will palpate the bones to locate any area of edema or tenderness. So now I will palpate any area of the bones for edema or tenderness. So upon palpation, there is no edema or sign of edema and no tenderness. That's all for today, and once again, my name is Geraldine Lanzaderas, your student nurse, and thank you Mr. John for your full cooperation in this physical examination of the geriatric nursing assessment.